Hello and welcome back to my new class for the physiotherapy student or the nursing student. They may go through it. So today I came with the topic equation of motion. So equation of motion in respiratory or the to monitor or to check the ventilator's needs. For first of all, we need to know the component of respiration. component component of respiration, respiration. So we need to know the component of respiration. There are two components mainly. One is ARTIF, artificial airway, plus conduction airway. So artificial airway we have is the tube that are connected from the ventilator till our E tube or the endotracheal tube or any other, plus conducting airway. Conducting airway is our airway that consists of trachea, bronchioles, brachials. These are the conducting airway of our body. So the air that comes through the artificial airway and the conducting airway can meet with the delta resistance, right? So it meet with the resistance, and it depend upon the pressure that is given from the ventilator divided by the flow. So then if we see the pressure, which will be resistance times flow. This is the pressure for the that is calculated or indented on the airway. So next is we have is lungs and chest wall. Chest, WALL wall. So the airway that comes from the air that comes from the airway, it needs the some amount of the air that comes from the airway, it requires the compliance of the lungs, right? So we can give so let us write a small diagram so you will understand it better. This is the FLOW flow, then VOLUME volume. Okay, so flow, and this phase is called, the flow phase is called the trans airway pressure or the resistant pressure, and the whole of this flow plus the volume, it is called trans respiratory pressure. Okay, so after that, I have already told that the flow that has come from the airway to the lungs or the alveoli or the chest, it requires the compliance of the lungs as well as the chest. So the flow or the compliance is equal to the compliance of the chest and the lungs will be equal to the volume of the air comes by the pressure at which it is coming. So pressure is equal to volume by static compliance. So from here we can generate the formula for the motion. We know that the motion of the airway or the equation of motion, sorry, my hand redness is due to the effect of the heater, so it's not like that bad. So equation of motion is given by pressure of resistance exerted in resistance plus uh, pressure exerted in compliance of the lung. These two, it will give the pressure. So equation of motion or the pressure, we know that it is the pressure of ventilator plus pressure of muscle minus the x square p, okay, which is equal to P resistance, which is also given by R times F, as I mentioned over here, then R times F plus P compliance is given by V by C compliance, right? So this is the formula. For example, if we give the example in volume control as well as pressure control. So in volume control, if we want to deliver a 500 ml of the tidal volume or the volume per breath, okay, so it will eventually dp is equal to R times F plus V by C. So this V is 500. So when R is increased, resistance is high, then flow is also high, but the compliance is low. Resistance high already and elasticity of the lungs is very low. Then the pressure will increase to push this 500 ml of the air into the lung. Whereas if resistance is decreased, flow is also, don't talk about flow, let's talk about really resistance and compliance. If resistance is low, compliance is very high, then pressure to give 500 ml will be very low pressure, okay. So this is the advantage of volume control. Whereas in pressure control dp, if we keep this as 15 mmHg pressure, so R times F V by C. So to deliver 15 mm, we have said that the pressure is only 15 mmHg. So if in case resistance is very high, in this case, okay, let's consider resistance is high, then again lung compliance is very low, then the patient will get limited or less volume of air. So patient will get more. Then in case of resistance is low and compliance is very high, lung compliance elasticity is very high, then with this 15 mg patient will get very high amount of air. So this way we can understand the formula of motion, how to apply over the patient. Let's keep an example for COPD patient. For COPD, okay, COPD patient. So for COPD patient, D equal to R times F V by C, okay, compliance. For COPD patient, lung compliance will be less, resistance in breathing will be very high, right? So pressure will be high. If for the volume, if we control 350 ml, okay, if we want to give 350 ml, then pressure will be also high. But if we keep same, okay, let's keep as a pressure control. If doctor has keep the pressure control, okay, so doctor has prescribed resistance high, lung compliance is low, they say that this in this way, then they kept 15 mmHg, where resistance, let's keep resistance is low, then force, then V by C is lung compliance is now is high, but we don't see how the compliance is high, resistance is low or not, because sometimes it may become the opposite. then it may harm our lung. So lung protective ventilation may fail in this case. So if this is the case, then the patient may get high amount of oxygen, but we don't know what amount by 15 mmHg. But if we keep volume control, in most setting I have seen volume control, but if we keep volume control, then we can see the pressure. If resistance, if what you say, compliance is high or low, then pressure will be maintained automatically, but it will anyhow deliver the amount of air that has been given. So basically tidal volume is calculated, how much to give is the age of the patient, right? So we can give example, if the patient is let's say the formula for male is 50 kg plus 2.3 kg plus this is the ideal body weight calculation formula. Okay, then 60 minus height of the patient in inches. Okay, so sorry, height of the patient in inches minus 60. So after that you will get one formula, one ideal body weight. Then calculate it using the formula for per kg. The scientific given is 6 to 8 ml per kg per ideal body weight. Okay, so this can be decided by therapy itself. That is the simple formula. So if we see in graph, okay, this is the graph you will see in the ventilator pressure and climb, then you will notice that it will be like peak, then shunt, then go down, right? So this is expiration, this is inspiration, right? So you can see here, this is the plateau. Let's say this is the plateau. So okay, this is the resistance from the P peak. Then this is your trans airway resistance. This is your trans airway resistance. Okay, this is your P plateau.